for everyday life. Good morning, Brian. Whom are you talking to today?
Well, good morning, Mabel. This morning we are going to look at a condition that is a hereditary blood disorder characterized by red blood cells that assume an abnormal, rigid sickle shape. What are we talking about? We'll be looking at the signs and symptoms of the sickle cell disease, but also what can you do as a parent, as a patient, and maybe it's about to happen to you. When is it time to go and check whether you're a carrier or a sickler? Coming up on Everyday Life.
Just say Evelyn.
This morning on Healthy Wednesday, joining us, Evelyn Mwesigwa from Sickle Cell Network. Good morning.
Good morning, Brian.
And Ssebandeke, Ashiraf. Good morning.
Good morning.
How are you?
I'm good.
Thank you so much for coming. I'll start with you, Evelyn. You're from the Sickle Cell Network. Tell us about how serious this is. Any statistics in the country and how many patients that come in every day to be diagnosed, or the tours that you're doing in the villages. What numbers are we looking at?
With the Sickle Cell Network, as an organization, we do not have our own numbers, but there have been some numbers which are there through which have been compiled by the Sickle Cell Association. But with the numbers, the specific numbers, let me give my colleague Ashiraf. He has better numbers. He has compiled some numbers that I think he can answer that question better. Okay,
according to the survey that was done in 1940s, it was found out that 20% of Ugandans carry the sickle cell gene. And the highest region with the gene is Bamba, because by then they were doing it according to tribes. It was Bamba at 45%, which is the highest in the world.
But Ashraf, that's 1940, before we even got our independence.
Yeah, that's the available data. That's the statistics we have.
By the population, then.
Yeah.
So is that what you organizations are working with?
Because they haven't yet been updated. There have been efforts by Ministry of Health, Makerere University School of Public Health, and Shishnat Children's Hospital to come up with the new findings. They presented their preliminary findings, which put the highest at 18.6. And that's northern region.
Okay.
But that's still preliminary. It's not final, because they started in February and we are in June. So it's not the final, but it has been 60 years since the first data was collected.
Which means the true data right now of people who carry the gene and people who have sickle cell disease is unknown as of now. Because when you go to Mulago right now, when you read some reports, they show you that 25,000 children are born a year with sickle cell disease. That is according to the report. But Brian, I want to ask, if someone gives birth in Kabale to a child with a gene or with a sickle cell disease, who is going to know? Does Kabale have a testing machine for sickle cell disease? Let us go to Busoga region, which has one of the highest numbers. Do they have a machine in their referral hospitals? How do we know these numbers right from the grassroots? And people do not know where to go to even test.
You talked about genes. How does someone know they are a sickler? How do you diagnose the disease?
The first way they can do it is by a sickling test, which is a simple test. It can be done, but it turns positive for someone who is a carrier and positive for someone who is sickle cell. So to confirm whether you're a carrier or you have sickle cell, you have to do an HB, electrophoresis test, which can confirm whether you're a carrier or a sickler or a normal.
Okay. And those are the machines that are not available?
We have in Mulago Hospital, we have in Zambia Hospital, then we have in the private centers like Abbey Clinic, Ebenezer. Yes.
Okay, for the benefit of people watching us, for me, the scanty information I have, you know, A, SC, something, there's a way you cross those, you know, just break it down for us. You're a carrier, for example. You have featured on Life Stories before.
Yes.
So what does that mean? How do the genes work? X, Y, those things?
We have A gene, that's the normal gene.
A G.
A gene, A, as in A,
just
alphabet
A.
And the S gene. So if you have, because we inherit one gene from a mother and another gene from a father. So if you inherit A from a mother, A from a father, you are normal. If you inherit A from one parent and you inherit S from another parent, you become a carrier. Because you carry the S is the sickle gene.
Okay.
So you are a carrier. You don't get the pain normally, except in rare cases, but you can pass that gene to the next generation,
now,
to your children.
Brian, what happens? Let us look at each other as a couple. I have AA blood. He have AS. There is a chance that one of our children will have either my AA or he will take A and S from him. Now, when you marry a person who has AS, that is, he has a gene of a sickle cell and she has a gene of sickle cell. Now, that is where the trouble comes. When you have children.
When both are carriers.
When both of you are carriers, that is where the trouble comes from. Now, that is the core of the sickle cell network, the sensitization. Brian, we need the young people to know before they marry what type of blood you have. We call it genotype. What is your genotype? Are you AA? Are you AS? Are you SS? SS is the sickle cell. Typically, you have the disease. Here the term they refer to is you're sickler. But the fact is you're a person living with a sickle cell disease. You have sickle cell disease. What he was referring to as SS, that is a person who totally has the disease.
Yes.
AS, you carry the gene. You are just carrying the gene. The trouble is when you're carrying the gene, you live normally. You will not know that you have it until you have tested.
Are there signs you can catch, especially for parents, when the child is still young? Can you catch it, or even when you're old?
That you're AS?
Does the disease manifest later in life, and you wonder?
Brian, there is no way you can know that you carry the gene until you have tested. That is the trouble. You marry your partner who is also carrying the gene, because when you're getting married, they only ask for the HIV test.
Yes.
I don't know if when you're getting married, what did they ask for?
Well, I did lots of tests.
Because you were aware.
Yes.
I
was not even aware. I was just given a list of things I should test, and we thought, okay, why don't we just test for everything and find out if.
And they came out well.
Yes.
But
those are very few people who.
There are very few people.
You are a sickler. Tell us.
He's a carrier.
I'm a carrier.
Tell us some of the things that you've gone through.
Let me put it this: I'm a carrier, but I'm one of the rare cases of people who are carriers and they experience pain.
Even when you read, they tell you a carrier is not supposed to go through pain.
To be sick.
My colleague here, when you look at him, you can say that he's a total sickler.
Yes.
These are the rare cases worldwide of a carrier being in pain.
Being in pain. Yeah.
Even when he goes to doctors, some don't even appreciate that he's in pain.
Because they don't understand that a carrier, you know.
Yeah, I am a carrier. I am a carrier.
You are.
There is no way my son would be sick if I was not a carrier.
Yeah.
But I have nothing. I have no pain. I have nothing.
Yeah, you look healthy.
So for me, I've been living in pain. Because all along I thought I had sickle cell disease because of the symptoms, because of the complications I was going through. Until when I went, because I used to do sickling test, as I told you, because it comes out positive for a sickler and a carrier. So until when I did the HB test, which is 2 years back, and I found out that I was
just a carrier,
but experiencing pain. So I have been living in pain. I experienced pain, joint pain, pain in stomach. And on top of that, because I experience the same pain as someone with sickle cell, and on top of that, I get pain that people with sickle cell don't get. For example, sometimes I find out that I'm in pain. I go to bed. The moment I enter bed, I start experiencing pain. I wake up in pain. Wow. And I didn't know, because I used to ask my colleagues who have sickle cell, and they were telling me they are not experiencing that kind of pain. Until when I featured on Life Stories, and I got someone else. She's also a carrier, and
Going through the same pain.
Get sick, and she didn't know. So I talked to her, and I found out that we are getting similar kind of pain, like the night pain and morning pain. And we didn't know that. If for her, she didn't know that it's related to being a carrier. But for me, I thought it was for me being a sickler.
Brian, you asked about the symptoms. For the children, they swell their palms, like from 6 months. Some start early.
As 3 months.
They swell the palms and the feet. That is one of the simplest symptoms. Others, the child can cry too much because of the pain. When you go to Mwesigwa and the baby is crying too much, definitely as of now.
It's not colic.
Sorry?
It may not be colic for kids.
It may not be. The moment you go to Mwesigwa as of now and the child is crying non-stop, there's no malaria, there's no stomach pain, there's nothing, they do a sickle cell. They do now.
Right.
Even in other, because they know the pains are too intense. So the child will cry and cry. But normally, because we know babies cry because of the stomach pains, there are some local words they use for that. So you go on. That's what happened to us.
Ajakuona.
Oboka. So we thought Jeremy was just a crying baby.
Yeah.
So we kept it like that. We kept it like that. But one of the first symptoms is the swelling of the palms. We saw that, but we didn't know. And Brian, how can you even think about having sickle cell, a child with sickle cell disease when in your family there's not even one person
who has it?
Who has it? And you've never heard about it.
I fear to ask you, so how did you... All right, there's no person in your family who has it. How did it...
That is the hardest bit.
You're a mother of a child who is sick.
Yes.
Tell us about how it has been caring for him.
I think it's one of the hardest things. Because when you find out that first, the shock of knowing that your son has sickle cell disease and you don't know how. Brian, that is hard. Because everyone is going to ask you, it came from your man. The man brought it. Then the man side, they say, it came from your...
From your side.
Not until we tested. And I found I was a carrier, and he was a carrier. Then the question going back to your family and like, how did it come? Who gave it to me? Is it my dad? Is it my...
Right.
We may laugh about it, but to face the facts, you need to know where did it come from. Is it from my father? Is it from my mom? Then your mom, if she's a carrier, she needs to know, did it come from her father or her mother? The line is...
In scenarios like this, do you help partners, for example? Because someone can say, you know, you trapped me and you gave me this disease. Do you encourage, say, carriers to marry each other or? No. That is why when we are doing the sensitization, we encourage the young people. Please, when you are a carrier, do not marry a carrier. Brian, here we do not have the life that you can get married and then you adopt children. We want our own biological children. Yeah.
You cannot play in the chances that I'll bring maybe one may be sick, maybe another may not be sick. You can't play in those chances. So you asked about the care for the child. It's hard. It's hard. Brian, last year my child was sick for over 8 months. They had to put him on chemo, hydroxyurea, because his condition was really, really bad. He has had over 7 transfusions. And this is a boy whereby you just wake up and you find him, he's totally yellow. And you go to the hospital and his HB is 3.5, his HB is 4. Sometimes you go to the hospital and there's no blood at that very moment.
Yes.
It's not that they keep it and they are
There's
holding
so many
it
people
back.
to take care of it.
So many.
Yeah.
They give you 1 pint or 2 and then you go back home. And after a month you go and you check and it is down again. But one thing I want to show you is, as a parent, you need to learn how to manage your child at home.
Right.
You can't go to the hospital every week. At the Sickle Cell Network, we are looking at empowering parents and caregivers and guardians. We call them cells, Brian. We create cells in our homes, in our villages. I am a mother of a sickler, you're father of a sickler somewhere. We keep in touch.
And just advise each other.
We call each other.
Right.
My child has a problem here. And like, okay, I know somebody else. I know this doctor. And then we want to create friendship with doctors. I have a wonderful doctor. Actually, 2 wonderful doctors. Dr. Poka in Mulago and Dr. Evans Ssebandeke. Ssebandeke sits me down and tells me, Evelyn, you are the first doctor to your child. Sit down, learn what has to be done. Every parent should learn that we have to give our children folic acid every day. We have to give them fruits. We have to give them vegetables. We have to avoid malaria. We have to avoid everything that brings the body to go into pain.
Ashraf, for people that have, what do you want young people, especially young people, to know? What? So as we wind this, because I know there's a lot talk about, the condition.
So young people need to know their gene type. You have to know whether you're a carrier or a sickler. That's why our sensitization is going back to schools, because this is where families
schools
are
and
made.
Worship centers.
And worship centers, because this is where people still have trust in religious leaders. So we want them to understand that this, as long as we say that you have 1 in 4 chances of having someone with sickle cell if you marry and you're a carrier, but these are just computations. You find a family with 3 people, they all have sickle cell. So you are not going to have that burden. So you need to know your gene type, you need to know whether you're a carrier or you are a normal person. And when you are choosing a partner, you have to choose, if you're a carrier, you choose someone who is not, so that your offspring comes out when they are normal, or at least when you have someone.
Don't forget, when someone has sickle cell disease, you can marry somebody who does not have sickle cell disease or a gene. Surprisingly, if you have sickle cell disease and you marry someone who is free, sickle cell free, none of your children will have sickle cell disease. They will only be carriers.
So there's a chance that your children will be healthier if you make the right choice of a partner.
The whole issue is the choice and knowledge.
Well, I hope, obviously we are fast spent on time. We can't finish this whole debate, but we can obviously come and invite you back on this show. Go and test. That's it. Go and test.
Before you marry.
If you're about to get married, well, on the list they'll tell us test for HIV, hepatitis B. Just go and test, please, and make sure that you guard at least your offspring. If you are with a sickler, of course, you can also go to Mulago and find out more information on how you can treat those children. We'll be posting the information of Sickle Cell Network on our Facebook page and Twitter handle, and you can get in touch with these 2 people. Government must increase the availability of sickle cell testing countrywide, but not providing service to only those places. That is Gonzani Wandira on Facebook. Irumba Mweba is saying many people don't know that they have sickle cell because they do not know the signs. Actually, the sickle cell cases have increased, and government should start testing each baby born if possible. Sure. Thank you so much for your feedback. That's just a sample of it. Continue discussion on Twitter and Facebook, and of course we'll get 2 guests on the